A battle is brewing in Sacramento over how to best handle health care reform. Today, a state senator leading one side brought his argument to the Bay Area. KTVU's Patty Lee is live in San Francisco with a live report. Patty.
President-elect Obama has called for a national discussion on health care reform. And starting this week through the end of the year, communities are gathering to discuss the possibility of real change.
And then on the tables, we're putting the postcards to Obama.
At St. Mary's Cathedral in San Francisco, this group of advocates from across the state gathered to discuss the possibility of universal health care by cutting out the private health insurance industry.
Because they do nothing except avoid the sick, pass costs on to others, and avoid paying bills.
State Senator Mark Leno, who takes office next month, recently declared intentions to revive a plan to establish a statewide, publicly funded health care program.
The state becomes the single payer of health care provision. Your doctor doesn't change, your hospital doesn't change, the only change is how your health provider gets paid.
The bill has been vetoed twice in the past 2 years by Governor Schwarzenegger, who likened it to socialized medicine and warned it could hurt already struggling businesses. Meantime, compromise bills are stalling in committees. All the while, 7 million Californians, including 1 million children, are uninsured.
I agree something has to be done. I mean, health care for me is a major expense.
Howard Epstein says paying out of pocket for insurance rivals the cost of his mortgage. But the Republican in him just can't support entrusting the government with a solution.
I don't think that the government is very good at running things. I don't think they don't have a business-like approach.
But single-payer advocates say too much attention to bottom lines is the heart of the health care crisis. And it forces self-described regular citizens like Emily Brown to live with a degree of uncertainty.
If I didn't get it covered by my work, I would not be able to take the necessary medications that I'm supposed to be on every day for my heart. So that's pretty scary.
Back at church, as this group launches in on their lunches, they show off the names of their growing number of supporters and say it demonstrates the tide is turning.
Leno says because the national economy is in a tailspin and state coffers are shrinking, it will be easy for critics to fan fears about a single-payer plan. His goal is to help educate the public about the details, push for a change in the governor's office, and support Mr. Obama with his reform campaign. Reporting live in San Francisco, Patty Lee, KTVU, Channel 2 News.